Hello? Yes. Can I have your address?
Such phone calls almost daily are admitted to the hospital. This place is the last hope for those who are going through vulnerable moments of life. But for physicians, it doesn't matter the diagnosis of their patients. Their most important challenge is palliative care. Now another group of physicians are providing patient care to Chol Sharifova. She is registered to this hospital and her illness does not require treatment, but pain relief. The fourth stage of cancer torments her for 7 years.
After drinking a glass of cola, the pain worsened. I had not been so sick before, started bleeding. After that, my body started to burn. Only I and God know of this pain.
Neither surgery nor long-term treatment helped her. In the latest medical analysis, it was evident that the disease is developing every day. She has bladder cancer of the 4th degree.
She does not require treatment, but palliative care. Medical history does not recall cures to this disease.
In the initial stages, it is possible to cure cancer. Chol Sharifova asked for help when the disease has already crossed the border and now cannot be treated or cured.
When we took her to doctors, they immediately said that they diagnosed cancer and there was surgery. My mom does not know that she has cancer. Only we know of this. She has told that she had a kidney infection.
Hospital nurses here are especially careful. Unfortunately, there are more patients who are late to get treated. They come for painkillers. The number of patients is increasing each time. Try not to worry, Mom.
From May 2012 until the present time, palliative care was provided to 160 people. We also provided care at home. In the metropolitan district of Firdausi are registered 169 patients. We give them the latest help. These patients live their last moments. Therefore, we use special medicines lead to loss of sensitivity. Such patients receive free care.
Free medical care and special medicines are not only for adults, but also children. Sangimoh Mamalieva is 13 years old. She has cancer of the throat and nose. Now all hope is for chemotherapy. The child is constantly suffocating.
My throat is blocked. I could not even drink. Only after all this brought me to the doctors. This is the 3rd course of chemotherapy. I was in a serious condition and now I feel a little easier.
According to oncologists, the main factor contributing to the development of cancer of the 3rd and 4th degree is carelessness of the public to their personal health. But in the meantime, incorrect analysis results lead to the development of the disease.
In 2012, our department was appealed by 505 people. 320 of them were cancer patients. Every year, we are approached from 100 to 120 new patients. Until that time, this year we had 85 people registered. In general, the first 9 months of this year, in the Children's Oncology Department were registered 315 children with cancer.
In Tajikistan each year, more than 3,000 people are diagnosed with cancer. So far in the country, it is identified that more than 13,000 people have cancer.
Of this number, 55–60% have cancer of 3rd and 4th degree. And these people don't need treatment, but palliative care, since in these stages of the disease, there are no paths for cure.
palliative care in Tajikistan has been introduced relatively recently. As in the past, cancer patients of the 3rd and 4th degree were discharged from the hospital and waited for death with horrible pain. Now, so that they did not feel physical and psychological pain, to facilitate it is used special medicines to lighten the excruciating pain. In developed countries, palliative care was introduced in 1982. In the beginning, it was understood as a pre-dying service. Despite the fact that this sphere of medicine is developing, fundamentally, this concept remains at just that.